extension and beautiful facility. They've done a lot of extra new buildings and things going on, so they keep expanding and doing some really great stuff. Leiah Bowden is sitting next to me, and she is the Corporate Communications Director of Daughters of Sarah, and I'll introduce everybody so we know who everybody is. Next to her is Joan Healey, and Joan is the COO, the Chief Operating Officer and Administrator of Daughters of Sarah Senior Community and Nursing Home. And then we have, right next to her, I had to look up, Criastie Holland. And Criastie is a physical therapist. She has her doctorate in that, and she's the director of the Rehabilitation Center at Daughters of Sarah. And next to her is Laurie Lichorat, and she's a registered nurse and manager of the short-term rehab center at Daughters of Sarah. This facility covers almost everything, doesn't it?
We do.
Everything.
We do, and Joan is the COO. She really covers the whole spread, so why don't you...
Right.
Well, we have a 210-bed nursing facility, which includes our short-term subacute rehab program.
So if a person has a stroke, they might go there for rehab.
And then go home,
yeah,
or go back to live with their family or wherever, to another assisted living.
Sometimes it just takes some rehab to get through
that.
Yeah.
And the average time is about 40 to 60 days in rehab. And then people go home, back into the community. We also have a 56 apartment assisted living program for people who just need a little bit of help and supervision. We offer assistance with medications, also helping people with their bathing and dressing, and it includes 3 meals a day.
So if a couple one of them needs more care, is it okay for
it's wonderful. One lives,
the spouse or
one lives in the nursing center and one lives in the Massery assisted living, and there's a connecting corridor, so they don't even have to go outside. They can visit each other. Staff will bring them back and forth, and it really works out. It's beautiful because they can stay together and still get the care that individually they need.
Right, and you have a memory center too?
Yes, we have a memory enhancement center. It's a 36-bedroom unit, all private rooms, all on one level, and that's for people who may wander, have problems with their memory.
Security.
Right, very secure, and it also affords them the opportunity to walk around and be independent and yet very safe. This might be a good time to show a couple of the commercials that you have, and so we can see.
Right. And then we have some photographs too we can show you so that you get a picture of what we're talking about. Greg, could you pull that?
Can do. A slip or a fall can really do you in, even if you're fairly young and healthy. If your doctor prescribes rehabilitation therapy, Daughters of Sarah will help you get your agility back with lots of TLC, your own private room, and restaurant-style dining.
Come to the Rehabilitation Center at Daughters of Sarah for therapy that works, so you can too. After any injury, you may need therapy. To get your strength and agility back with lots of TLC, your own private room, and dignified dining, choose the Rehabilitation Center at Daughters of Sarah for therapy that works, so you can too.
I'd like to maybe ask Criastie here, you're a physical therapist. If I had an injury and I need to see a physical therapist, would I go to you or would I just go somewhere else? I mean, I don't know how open your center is.
You could definitely come to see us. We, in our facility, in the rehab department, we have physical therapy, occupational therapy, and speech therapy. And we've got
You don't have to be a resident then to get
No,
home.
we service our long-term residents, and we also service the residents that are in our short-term subacute unit, and we also have the ability to provide outpatient therapy as well for all of the disciplines. So we do a little bit of everything there.
Yeah, it's one size fits all maybe. I mean, you do it all.
Yeah.
Let's talk about nursing. How are you involved in all this?
Nursing is, it's the tie that binds all of the services together because people are coming into us more often than not.
Do you do the assessments then? Or?
Yes, I do.
Okay.
I do. On this particular unit, there are multiple RNs that are involved. I'm managing the unit, so I have eyes upon everybody that comes through the door. At that point, Criastie and I normally will get together and we take a team approach to how we're going to manage a patient's course. And I think on that point, they come into us as patients. They become our residents. So we try to remove the piece of healthcare that's hospital setting, and we're a home setting. So the creature comforts of home, things that you may think about missing your TV or missing the window that you look out of, having your own bathroom. Those are all things that we feel will aid in somebody's healing because you're maximizing that.
That's so important what you say, because people that are faced with a decision to make, whether to leave their home or maybe they don't even have that decision, they have to do it because of a problem that's coming up, that people don't want to leave their security of being their independent home setting. How do you all, and it sounds like you try to address that, is that correct?
We start addressing that right on admission from the very beginning stages of an assessment. You are asking questions. What's it like at home? Do you have staircases? What are your challenges? Do they have pets? We have pets in our facility.
You
we
do?
have pet
Wonderful.
therapy. We have animals that come
But
in.
the pets are so healing.
Absolutely.
And to give up your home and give up the pet that you've had for 5 years is pretty tough.
And they come in to visit too.
Yeah.
So if somebody's got their dog at home, you will see families coming in with a leash in tow, grandkids in tow.
Yeah.
And for the time that they're with us, this is our home. So we want to try and keep that setting in place. And we're also dealing with all the dynamics of healing. Fear over recent surgery. Will I walk again? Is this going to work for me? There's so many different aspects that are involved in the rehab course. And within a week and a half of somebody being there, we as a team will meet with the family and let them know this is where you're at. This is where the average person would be at this stage, and whether it's a broken hip or pneumonia or anything along that line, new diagnosis of heart conditions. We're dealing with this across the spectrum.
So you're looking at temporary, you're looking at permanent,
Absolutely.
you're looking,
Right.
and you always with probably the eye that maybe they can go home if things improve.
That's our focus for a lot of the patients that come into the rehab unit is while we try to make it feel like home while they're there, the goal for many of them is to go home, and we've been pretty successful with that.
Right. Did we take a look at the photographs?
We haven't yet.
Okay, let's take a look at the photographs.
Criastie, what's this machine
That machine's called a SciFit machine. It's a machine that allows people to do a little bit of aerobic activity, and it's also wheelchair accessible. So this,
Oh, nice.
yeah.
And this, well, Laurie, why don't you talk about
This is part of our dining experience, and again, going back to the thought process of preparing somebody to be home. Criastie's department runs a very vigorous rehab program, so some of these residents are tuckered out at the end of their therapies. They'll come back, they'll go into their rooms, they'll take a nap. Lunchtime comes, and they're walking into this
Is this one of the
beautiful
rooms?
dining room.
Yeah.
Wow.
Right.
We have plants there, there's socialized dining, people are ordering from a menu. There's
So
choices
it's like you're being
involved.
treated pretty special.
Yeah.
Yes, it's a small
And
private
it looks
dining
like
area.
he's as tall as his hat is. He must be an executive chef there.
Yes, he is.
And this is one of the rooms. Now, can people bring in their own artifacts or whatever art?
Absolutely.
Yeah. They can bring in chairs, pictures, anything they want. In fact, some people move their entire apartment into the
Well,
rooms.
that's okay.
So
If they got enough room. they
That's
can,
right.
How that goes. As long as they don't bring all the junk with it.
that's right, they do.
But one of the important things, of course, is having pictures and having the things that make you feel like it's a home.
Right, and I have to say that the Buildings and Services Department at the Nursing Center is terrific. My uncle was in the nursing home for a while, and he wanted umpteen photographs hung exactly there or
Oh,
exactly
that's
there,
great.
even if that's not where we
But he
usually...
took ownership of his
Oh,
room.
he took ownership, all right, and
All righty.
and the staff was very, very
Yeah,
accommodating.
yeah.
As a family member, I got to see what Daughters of Sarah Nursing Center is like, and it really was very accommodating. It was great.
I know my daughter, when she first got her nursing degree, worked at Daughters of Sarah, and she spoke very highly of it, yeah. So it was really kind of, that was the first time I really knew about it. I heard it through a nurse that was working there, and she loved working with the people there. But that was a long time ago, and I'm sure that things have changed since then. And more recently, we've known someone that was in the Memory Enhancement Center, and it was, I thought that she was treated very well, and she was one of the people that brought everything in to the room.
Right.
She's no longer with us, but it was one of those, it was a great interim there. So
Yeah.
anyway. You have a fundraiser coming up.
We
Well,
do
you're
have a
nonprofit, see, so you can have a fundraiser.
We're not only nonprofit, we're a nonprofit healthcare facility,
Okay.
and like many others, we're really getting
Every-
pinched by the current economic
I mean,
situation.
every nonprofit is.
Right.
yeah.
Our nonprofit is having a mystery challenge.
It
For
looks
the
great,
past
yeah.
3 years, we had something called a mystery hunt. And people would get together in teams at the New York State Museum, led by
I
a
saw
company.
that. It's a museum.
It's a museum. And Watson Adventures, which is a company that puts these on all
Oh,
throughout the
okay. I
country,
didn't even.
they come up and they visit the museum ahead of time, and they pick out areas that will be really neat to have clues in. And so teams of people come in, and we feed them well, and so it's a lot of fun.
So it's like an evening?
It's
era?
a whole evening. It's going to be
Okay.
November 14th
Okay.
At the New York State Museum. It's
What a
called
great
the
idea.
Mystery Challenge. So it's fun. It's a fundraiser, and it helps support everything.
And what do they get if they find everything they're supposed to?
A lot of fun, bragging rights, and a very small reward.
Well, the reward is that you're helping an organization out.
Right.
Isn't that the big
Right.
thing about that? How long have you been around? How long has Daughters of Sarah been there? I know it's been a long time.
Well, we opened in 1942 in
Okay.
Albany in a private home with,
Oh, really?
with
I
19
didn't know
beds
that.
on Western Avenue.
Okay.
Right. And then, and it was an interesting way it started. There were a lot of people who, after the Depression, simply couldn't care for themselves, and they were at risk. And so the Jewish community saw that many of their own members
Always been very caring.
right, and so they started this Hebrew Home for the Aged. And pretty
Oh,
soon,
it was called the Hebrew
Home for the
Aged.
Aged.
Okay.
There's a mystery sort of about exactly where the name Daughters of Sarah came from.
Well,
if anyone out there knows,
Sarah's
biblical, definitely,
Yes.
and she had no daughters that we know
Oh,
of.
she didn't have any.
All women were our daughters of
That's
Sarah.
right.
Well, it's like I belong to the Sons of Italy, and I don't look like a son.
Right. So
So
over
there can be Daughters of Sarah.
That's right.
so over the
At
years,
least my gender would be right if I
That's
knew
right.
that.
so over the years, the need increased, and voila, here we are now with an assisted living
Yeah.
facility and a nursing center.
And you keep expanding. I mean, every time I drive by, it seems as though there's a little construction going on, and it's so pleasant to the eye to see it. I mean, it's very well laid out.
One of the things that we're really happy to be able to provide is a really rural, beautiful setting with natural landscapes and turkeys and deer. And do you ever see the turkeys?
Absolutely, especially off of the rehab unit, they seem to congregate there.
Isn't
So
that neat? Yes.
you can be walking through the dining room and you look out and there's a field of 15 to 20 turkeys.
So you didn't have any trouble at Thanksgiving?
No, we're all set.
No.
And I think our
No
private,
wild turkey unless.
our private rooms are really special for people because when you're 80 or 90 years old, the thought of getting a roommate for the first time, other than your spouse or a family member, is pretty overwhelming. And the fact that
Can't
we
even
have
imagine it. I mean, with all the idiosyncrasies we'll have
Right.
at that age,
Right.
it's like, oh, I don't think I want to share them with anybody.
That's
And
right.
I don't want anybody to share theirs
That's
with me.
right.
So it's a private room in the whole nursing center,
Right.
not just the memory enhancement or the rehab, with bathroom.
Right. So check it out. Might be interesting just to, do you ever have open houses?
We do occasionally have an open house.
But you can come anytime for
so
a
you'll
tour.
show.
Sure.
Okay, good. And you saw it on TV here. I want to thank you all for being here and sharing the work that you do. It doesn't look like you do a lot of work. I think you enjoy what you're doing. No, what I'm saying is you enjoy it. So right?
We do.
We
Yeah.
do.
Yeah, and when you enjoy it, it isn't really work.
That's right.
You're probably overloaded, but it's not work.
But it
That's
really is the feeling of family.
Yeah.
I mean, people say that, but it's really, really true here. That helps. Thank you.
Well, and thank you for all coming. And the time just flies, I know that. We're going to take a quick break, and this next break will be, the Sand Lake Center for the Arts at Averill Park. You'll find out about their big Civil War celebration. Well, it's not a war celebration. It's sort of is called, it's got a long title and I can't remember it. Oh, here it is. It's called Hard Times and Home Fires, Beyond the Battlefield from 1861 to 1865. It's a family